Understanding the difference between communicable and non-communicable diseases is crucial for effective prevention and treatment strategies. Communicable diseases, also known as infectious diseases, are caused by pathogens such as bacteria, viruses, fungi, or parasites, and can be spread from one person to another. Example include tuberculosis, HIV, AIDS, and dengue. On the other hand, non-communicable diseases are chronic conditions that are not caused by infectious agents and cannot be transmitted between people. These diseases often result from a combination of genetic, physiological, environmental, and behavioral factors. Examples include hypertension, diabetes, and asthma. Both types of diseases require different approaches for management and care, highlighting the importance of understanding their unique characteristics.
Every minute, tuberculosis silently affects life across the globe. It's a disease that knows no boundaries, impacting millions every year. Tuberculosis, or TB, is a communicable disease caused by a bacteria. Mycobacterium tuberculosis is mainly affect the lungs, but can spread to other parts of the body. How does TB spread? TB spread through the air when someone with active TB cough, sneeze, or speaks. It can infect anyone, but those with weak immune system are most at risk. Globally, over 10 million people are infected with TB each year, and nearly 1.6 lose their lives. It's one of the world's deadliest infectious diseases. Here in the Philippines, TB remains a major health challenge. In 2023, over 600,000 cases were reported, but the fight isn't over. Healthcare initiatives are making progress every day. TB is preventable and curable. Here's how you can help. Practice proper hygiene and wear masks in crowded areas. Get tested if you've been exposed. Follow the prescribed treatment plan to stop the spread.
HIV is a virus that attacks the immune system, weakening the body's ability to fight infections and diseases, potentially leading to AIDS if untreated. Globally, HIV remains a significant public health issue, affecting 39.9 million globally, particularly in regions with limited access to education and healthcare. In the Philippines, particularly here in Davao City, HIV cases have been rising of 433 HIV cases linked to stigma, insufficient awareness, and limited access to testing and treatment. Prevention involves safe practices of condoms, regular testing, awareness and campaigns, and of course, safe sex. While treatment with antiretroviral therapy has been ongoing, it can also effectively manage the virus, though there is no currently cure for HIV for now.
AIDS is the late stage of HIV infection. It occurs when the body's immune system is severely damaged by the virus, making the person vulnerable to opportunistic infections and certain cancers. How to avoid AIDS? First, practice safe sex. Use condoms correctly every time you have sex. Second, if you have HIV, taking antiretroviral therapy as prescribed can prevent the progression to AIDS. Third, use pre-exposure prophylaxis is a daily pill that can help prevent HIV. Fourth, avoid sharing needles. If you inject drugs, use only sterile injections equipment. Signs and symptoms of AIDS are severe weight loss, persistent fever, night sweats, diarrhea that lasts for more than a week, sores of the mouth, anus or genitals, pneumonia, memory loss, depression, and other neurological disorders. Local and global impact. Globally, HIV or AIDS remains a significant public health issue. In 2023, an estimated 39.9 million people were living with HIV, with the majority in the World Health Organization African region. Despite advances in treatment, HIV continues to claim lives, with an estimated 630,000 deaths in 2023. Locally, in Davao City, the impact of AIDS is significant. As of December 2023, there were 1,855 reported cases of AIDS in Davao City, making it the area with the highest number of cases in the region. Most of these cases are among males, particularly those aged 25 to 34 years old. Efforts to combat the spread of AIDS in Davao City include promoting regular HIV testing, providing free medication and laboratory monitoring, and offering support through various treatment facilities such as the Reproductive Health and Wellness Center, Southern Philippines Medical Center, and Davao Doctors Hospital. The city's health authorities continue to emphasize the importance of knowing one's status and reducing the stigma associated with HIV and AIDS.
Dengue is a mosquito-borne viral disease caused by the dengue virus, which has 4 types. It's spread by the bite of an infected Aedes aegypti mosquito, which is most active during the day. Globally, dengue is a major public health issue. Did you know that there are around 390 million people are infected with dengue every year? Out of these, 96 million experience symptoms. Here in the Philippines, dengue is a constant threat. Over 100,000 cases are reported annually. In recent years, cases have surged during the rainy season, with children aged 5 to 14 being the most affected. Symptoms. The symptoms of dengue can range from mild to severe. For mild dengue fever, sudden high fever, severe headache, and pain behind the eyes, muscle and joint pain, sometimes called breakbone fever, rash, nausea, or vomiting. To avoid or prevent dengue, we must avoid mosquito bites, eliminate mosquito breeding sites, community action, vaccination, and lastly, be vigilant during the rainy seasons.
Good day everyone, today I'll discussing a pressing health concern in the Philippines, hypertension or high blood pressure. Hypertension affects around 37% of Filipino adults, making it a leading cause of cardiovascular diseases such as heart attacks and strokes. This silent killer often shows no symptoms, leading to life-threatening complications when left untreated. Here in Davao City, hypertension is also a significant public health issue. As of recent data, the morbidity rate for high blood pressure in the region is 360.6 cases per 100,000 people, one of the highest in the country. So hypertension can result from unhealthy diets that are high in salt, sugar, and fats, lack of physical activity and sedentary lifestyles, chronic stress and smoking, family history of hypertension. So the good news is that hypertension can often be prevented or controlled. Experts recommend maintain a balanced diet that is rich in fruits and vegetables and also those that are low in sodium. Regular exercise, even 30 minutes daily, stress management through relaxation techniques, and also regular blood pressure monitoring and if needed, medication under a doctor's advice. So I encourage everyone to prioritize their health by adopting a heart-healthy lifestyle and staying informed. Let's work together to reduce hypertension rates here in Davao City and across the Philippines. Thank you.
Asthma is a chronic condition that affects the airways in the lungs, making them inflamed and narrowed, leading to difficulty in breathing. Common signs and symptoms include first, shortness of breath. Second is wheezing or the whistling sound when breathing. Next is tightness of the chest or pain. And lastly, coughing, especially at night or early in the morning. Asthma symptoms can be triggered by allergens like pollen or dust, physical activity, cold air, or respiratory infections. While there is no cure, asthma can be managed with proper medication, avoiding triggers and following a treatment plan provided by a healthcare professional. Early detection and regular management can help people with asthma live full and active lives.
What is diabetes? Diabetes is a condition where the body struggles to regulate blood sugar levels due to a lack of insulin or improper use. High blood sugar level can lead to serious health problems like heart disease, kidney issues, or vision loss. Early detection, a balanced diet, exercise, and proper treatment can help you live a healthy life. Know the signs: increased thirst, frequent urination, fatigue, or unexplained weight loss. Take charge of your health. Learn more about diabetes today.